Hi everyone. Hi, this is Christine Crow here, and today I really wanted to come in again and talk about something which is happening regarding the healthcare in terms of agency workers, agency care businesses, for example, going into the NHS. Today I was going to cover something slightly different, but this is really important, and I think that it needs to be discussed regarding how the his name is West Streeting, who is part of the health secretary, for example, is looking at meeting with organizations as well as the NHS, etc., to discuss whether they should ban the healthcare workers in terms of from agency. So if you're a support worker, if you're a healthcare worker, for example, and you work for an agency and you're band 2 and 3, they're discussing about not using you within the NHS, for example. Now, I wanted to do this video because I know there'll be quite a few care providers, for example, that could be worried about, what's going to happen if I'm providing staff to the NHS, for example, in terms of the healthcare workers, in terms of the band 2 and 3 support workers, for example. Now, they're not really referring to doctors, although they were talking about doctors to begin with. It really is to do with the providing healthcare staff in terms of support workers and carers, for example. Now, the article which I read in the news was the Daily Mail had discussed that agencies are ripping off the NHS, ripping off Britain, for example. I don't see it. I didn't see it in that way because the clients and the agencies that I know of certainly don't charge exorbitant fees to provide staff to the NHS. They provide staff that is within the contract that they have signed for, which was agreed by the NHS, because they should know what their budget is for providing, for you to provide a service to the NHS, for example. So in this article, though, they talked about how locum doctors are charging, the agency is charging £2,000 per shift, for example. And I've not known that figure to be that high. So this is there's not many agencies that are charging this price. It'll be the big ones, like they mentioned, Thornbury, for example. Although the specialism, if you are providing specialist staff members, that requires a skill, a specialist skill, which is very rare. So you are entitled to charge a higher price, for example. And for me, looking at the clients that I work with, they don't charge these types of fees, for example. Now, we've got the Contract Act, which is 2015, the Contract Act. And that Contract Act says that agencies should be given, small to medium-sized enterprises like my clients, for example, are to be given a equal playing field so that they can apply for contracts just like the big organizations, the large organizations do. Now, when we apply for contracts, it will say, is this suitable for small to medium-sized enterprises? Yes. Or it will say no, for example. So we only apply for contracts that is within the budget from what the NHS give us, and they tell us what those prices are. Now, our clients, care providers, aren't holding them hostage by charging exorbitant amount of money. They are the healthcare workers that they send in or support workers that they send in. They're only being paid the same as what the hospital staff are, if not less in some cases. So I wanted to come on here just to speak out and say that from what I've read and also from what is going to be happening on Wednesday, the consultation, there's no exorbitant fee. You know, the fee is the same price as what that staff member is getting in the hospital. So although they talk about fairness, it needs to be fairness for the agency worker that is going in, because bear in mind that agency worker doesn't get they don't get their, how can I say it? They don't get their pension benefits. They have to pay for these things from their self-employed money, for example. Holidays isn't the same. Then there's extra benefits if you was working as an NHS worker, support worker. You're actually getting paid more than what the agency staff gets. Because when you think about, they've got to be liable for all their accounting, they've got to put money aside for their pensions, they've got to pay their national insurance, for example, they get taxed as well. They've got to pay for lots of things, uniforms, their DBS, they've got to pay for a lot of things. So I don't really see why there's going to be this potential ban on agency workers going in to hospitals. Now, I also read that he was thinking of, and this is West Streeting, was thinking that if you are a permanent staff member and you work in the NHS, they're going to ban you from re-entering the hospital as a agency worker, for example. And it's as if you're being penalized for that. Now, I'm going to speak from my point of view, and this is my point of view only. When you have worked really hard in the hospital, and sometimes you don't feel appreciated, you're working long hours, you don't get a choice as to when you can work because you are contracted, and you do feel pressure. If you get a call, you feel pressure to go in, and that pressure is going to increase even more. That kind of worries me. And yes, they are recruiting, the NHS are recruiting candidates from abroad, for example, Africa, Philippines, for example, and that they will be, you know, a permanent staff member and signed up for 5 years, which is, it's good to work within the NHS. I'm not saying it isn't good to work within the NHS, but we should all have the freedom to work where we want to work. And if something is going to be better for you, isn't it better to choose the hours that you want to work, to be flexible so that you can spend time with family, for example, and you're not losing out on pay or a job because you want to spend time with your family and you can only do evenings, for example, or during the day or weekends, for example. And when I read this article, which was in the Daily Mail, it showed, you know, that there were doctors there, you know, and they're drinking, you know, like pina coladas or some coconut drink, you know, in the sun, really having a good time, laughing at the NHS. That's how I read it, as I saw it as that. And I I know it's not like that. Not many agencies charge high fees like that. Organizations, the very large organizations, not the ones that are doing 4, 5, 6 figures. And I put it to you, Wes Streeting, not to penalize the small, medium-sized organizations who are charging the fee that you have told us to charge or for us to bid for within your budget. We are not here to, and I'm only speaking for some of my clients that I know of, we're not here to bleed the NHS dry. We're here to work with the NHS. We're here to support and to provide a good standard of care so that the outcome is good for the patient, for example. Small organizations certainly don't charge £2,000 per shift. They don't, unless it is a locum doctor who is specialized, very highly specialized, and very hard to find. And sometimes they are hard to find, those specialist positions. So therefore, they can command more, for example, because of their specialisms. Now, when I read the article in the newspaper, it referred to that, but I wasn't sure what position that was relating to, why an agency would charge £2,000 for a shift, for example. It depends whether that person has worked 12 hours. It depends what the position is. Is it a neurosurgeon? You know, what is it, for example? Who is it? So if we do 2,000 and I divide that by 12, doing a 12-hour shift, that's £166 per hour. Now, it's a doctor. It's a doctor. And they're possibly specialist doctors. I do not see that as a problem because a doctor, a GP, they're being paid their rate, but then the agency has to put their charges on top for managing the service. So 20%, well, before it used to be you couldn't charge more than 55% due to price caps that came into place, for example. But this is a 20% on top of the doctor's salary, for example. I don't see that as exorbitant, for example. And I want to also point out that there's the NHS professionals, for example, the bank, the NHS bank, whereby staff members work for the agency, which is the NHS professionals, for example, which is wonderful and great. Okay. Now, when I looked, I did some research, I looked and I thought, okay, the turnover is this. You've saved the NHS 6.5 million, which is great and wonderful. But yet you took 18 million that was given to the owners of the NHS professionals. And I'm just speaking, I'm just trying to weigh things up here from what I've actually read. Now, what do the doctors get or the directors get in the NHS, for example? What do they get? We've really got to put things into perspective here because agency has been around for a long time and it will continue to be around. But they're saying because of the low grade jobs that we should cut that out to save money, for example. Now, how much money I'd like going to be saved with the low rate job, the band 2 and 3, for example, because I can't really see any savings, because if you're going to have a permanent staff member in there and they're probably getting, possibly 14, 15 pound an hour. And then there's all the other things on top, which is probably equating to 18, 19 pound an hour, depending on what time of day it is and whether it's evening, weekends, for example, because then that's more. Whereas some agencies charge a flat rate for the whole week. They'll charge a flat rate of, say, £15, 99, for example. I've seen contracts with the NHS and the rates are the same as what the staff members are getting that are working alongside in a permanent role. They're not getting additional money. I'm talking about the band 2 and 3 here, healthcare workers and support workers. They're not getting any additional money. But what I'd like to say to you, directors, care providers, is what we need to do is you got to look at upping what you do, providing specialized services. I always talk about the Navy SEAL. Train and work in that way so that you're covering all aspects, because you don't want to be hit with a crisis. I've got the 30-day challenge, and this is the 30-day challenge. This is day 28 of the 30-day challenge. And it's about you being aware of these challenges and how you're going to overcome them, and look at what the opportunities are within this challenge. And I'm going to talk to you about what those opportunities are for you right now. Is that you, as the care provider, can provide specialist staff members that are band 2 and band 3, but specialized, not generic, specialized. Another thing which you can do, and I'm referring to healthcare workers and support workers, is that you can go to the private hospitals instead. Everyone thinks must get contract with the NHS, and yeah, it's great, wonderful, yeah, but it is a lot. They demand a lot from you, which is understandable because we're dealing with people's lives. They want the best for the patients, and I totally agree with that 150%. But care providers, you got to see this as an opportunity. Don't run away from it. You run into it. I always think about Simone Biles, the Olympic medalist. Yeah, she was amazing. Yeah, she came through, she's overcome some difficulties, and she's been training for years and years, and that's why she was able to become world class at what she does. And you, as a care provider, need to become world class at what you do, because you will be faced with challenges. There'll always be someone saying, right, we're going to do this. Oh, we're not going to do this. Oh, let's try this. Oh, what do you think of this? Let's give it a go, kind of thing. So what is it can you do that is going to make you stand out? One of them is by you providing home care services in the community where you can work with the NHS. So, for example, the patient is in the hospital, it's time for discharge, they go home, and you then provide the service within that client's home, for example, providing home care. But there is a problem there, because CQC are taking its time for those that have gone through their registration, they've now got to wait to be rated by CQC. But people aren't being given a time frame of when that's going to be, because understandably, CQC are very busy, Care Quality Commission are very busy, and I understand that. But care providers need to be able to provide work to the NHS and to other organizations, councils that will accept them, because it's again, the small to medium sized businesses are being penalized in one way or another, which I don't think is fair. I've been a coach for over 10 years now, business coach, and I specialize in healthcare for 35 years. And I know what that feels like. I really do. To 1 minute you know where you're going, and then next minute, boom, we're gonna stop this. Like what's happening on Wednesday, there's a potential where they're going to look at not using the agency band 2 and band 3 staff members to the NHS, and this is going to start in April. So you haven't got long, and we need to think now about what we're going to do rather than wait till April hits you and then it's like, oh, I can't do this anymore. You don't want to have the situation like what I had, where I had a government contract and then suddenly they reduced the cost by half and they gave me 3 months notice. So care providers, don't put all your eggs in one basket. You've got to multiply, because if something goes, you've still got something else to hold you up. For example, go through and look at what else you can provide. You can provide home care if you are registered to provide home care. If you're not, get registered for CQC. You want to have a backup. And I'm asking you to start doing that now so that you've got a backup. The problem there is that with some contracts, they will say, right, we need you to be rated by CQC before you can get a contract with us. So then what you've got to look at, you've got to wait until you're registered with CQC, for example. And then you've got to wait to be rated before you can apply for a specific contract with the NHS. Not saying all of them are like that, but majority are, for example. Now, care providers, what I would suggest to you is that you look at subcontracting. I know you want your own contract, but subcontract first. So you've got some experience of running a care business. Because you need to have that experience, that proven track record that you know how to manage a service. Another thing, care providers, you can look at other aspects like private hospitals. Get registered with CQC if you're not registered with CQC. You've got this time factor now because the consultation is happening on Wednesday and the implementation is due to happen April 2025, for example. So your healthcare workers that you've got that are band 2 and 3, you need to get them trained and developed so that they're high skilled, that they are really specialized, and that they can provide a high skilled work. You've got to become a high skilled agency now. You can't just get away with just the generic stuff. You got to be above the rest. You got to be like the Richard Bransons and like the Thornbury, for example. You got to have specialized staff to be able to deliver your service that you want to do. So for a band 2 and 3, that needs to happen. They become specialized. For those of you that are recruiting staff members from abroad, for example, or for those that are watching that are going to be applying from abroad for sponsorship into the NHS, get in there and get in there now, because it's a good time for you to do that, because you will get 5 years security, for example. Sometimes you can even get free accommodation sometimes as well, and you can actually bring your spouses or your dependents over, for example. So that's one thing that I would say to those of you that are looking at, providing care as a carer, as a healthcare worker, support worker. Then come over, apply, get the visa, apply directly with the NHS, because it's not going to cost you anything if you do that. The only thing that you have to pay for is certain aspects, but there's even the aspects of where you've had to pay a fee for language testing, etc. You can claim that back, because the government has also acknowledged that there is no law to say that there must be a charge for that. So now there's going to be a clawback of that as well. Directors, I just want you to be informed. I just want you to be ahead of the game and not be, sort of found with pride, surprises. Oh, I didn't realize this. So I'm here to tell you that West Streeting on Wednesday is going to be discussing whether agency staff members should come into the hospital. They want to ban this, but the ones they're thinking of banning is the 2 and 3 band. That's healthcare workers and support workers. Or they don't want staff to be leaving, their permanent staff to be leaving the NHS to come and work for your agency, and then they're coming back in to their hospital. They will ban them on that basis as well. I don't know the full story regarding all of this, but I'm just letting you be aware of it. The REC, the Recruitment Employment Confederation, they are also saying that this is very short-sighted, that this is happening, that they're thinking of banning the healthcare workers. And yes, I know that they are recruiting staff from abroad, for example, and they're really being aggressive with that. And I think it's wonderful sponsorship. I think it's wonderful. The end of the day, it's going to help relieve those that are working there 24, a lot of hours, for example. So it should relieve the staff members, but staff will still feel overworked in certain departments. So they have to have the highly skilled workers in, because otherwise it's going to be more of a drain on the system. People are going to be more exhausted as well. So care providers, we've got to use the Navy SEAL Team 6 methodology, the Simone Biles methodology. Yeah, you've got to get stronger. You've got to build your skills. You've got to become world class at what you're doing so that you will get chosen. Become specialized. Don't just sit back and think, oh, I'm just going to be generic. You've got to be specialized, whether you're doing carers going in or whether you're providing nurses. You've got to be specialized. That is for 2025. You need to do that, and you need to prepare for that now so that you're not left out in the cold. You got to stand out, directors, and look for the opportunities that's suitable for you in your organization. And I'm going to be doing some training, but I needed to talk to you today about what is happening on Wednesday. If you're not aware of it, West Streeting, who is to do with the health of the NHS, for example. Obviously, Rachel Reeves has put in 2.5 4 billion, for example, into the NHS, which is really good. It's brilliant. I take my hat off to that. It's wonderful news. However, I think saying that they're going to ban the level 2 and 3 come April, that could be because the sponsorship, everyone's coming over, so they feel that they're going to be covered with that. But if you are specialized, then you will be needed. Become very specialized, become really significant that they need you. Become, just look at the rural areas, hard to reach areas as well. There's Scotland, there's Ireland, there's lots of different areas that you can provide your staff to. And I also wanted to say is that we are not, well, care providers are not charging any more than what the permanent staff member is getting. When you add everything up, it's about the same. And the NHS tell you what they're going to pay you, not the other way around. We can't say, pick the phone up and say, yeah, okay, yeah, we'll do that, but, we want double. It doesn't work that way at all. The care providers work with what they're being told that they will be paid, and they have to make that work. So I just wanted to come on here because I didn't like seeing the comment about agencies are ripping off the NHS, ripping off Britain. I don't agree with that. When I look at all of the other aspects, this is all a cogwheel and it's all working together. But we've got to look at what it is that we're providing and what we're being paid for. If you're providing a band 2 and 3, then the rate is certainly going to be lower, for example, and in some cases it is less than what the permanent staff members are getting. So I just wanted to put that out there so that we are aware, so that people are aware that when we're looking at the band 2 and 3, that they are being paid the same or less than what the NHS staff permanent is getting, because there's a lot of other factors that we have to think about. So I hope that that was helpful for you, care providers, and do like and subscribe for further training and discussions as well. Today is day 28 of the CEO challenge, and it's about you becoming an elite performer as a CEO. And it's about you being aware of all of these things and looking at these strategies that you can put in place so that you are not hit when the storm hits you, for example. You're weathering the storm. You're like that tree that's firmly in the ground and it's moving with the wind and it's not crashing down, so to speak. So prepare, do your Navy SEAL, prepare for what 2025 is going to look like for you. And that is you're going to have specialized staff members that are going to be able to support the NHS with the critical needs that they have currently. And that is what I'm referring to you. You become specialized. You have staff members that are trained in neuro, in cardio, all the specialist units, for example. That's where you need to train your staff so they can provide the service in those locations. And there's private hospitals as well as the care homes, as well as in the community. Become specialized. We can't just sit back and just be generic because people will just ignore you. So you want to stand out as an agency, become specialized. Look at what the digital space is doing and you become a part of that digital space. That way you can be strong in what you're providing and they're going to want to use you because you're not like everybody else. You're not Joe Bloggs. You're specialized. And that is the way to move forward with your business. So I hope that was helpful. Thank you so much for listening to me today. And I just want to say thank you for those of you that have booked. Lovely speaking with you. Thank you for your support as well, clients, for being loyal and standing by me as well. I do appreciate you. I always will be there for you. And I will always, always offer you something amazing that you're going to flourish with, but you've got to put the work in. Rome wasn't built in a day. If it was, it would have tumbled. And you don't want your business to be in that way at all. So thank you so much, everyone, for being here today. I hope that you've enjoyed what I've discussed today. I'm going to put the link here in the chat so that you can see. I'll also put a link here, but, don't worry. See this challenge as an opportunity. See it as an opportunity for you to grow in your business and for you to get stronger and stronger and stronger. That is a true leader. That is a world-class CEO, an elite performer, is always looking ahead, looking at what paradigms are happening and turning it and pivoting and providing that service, because that is what's going to push you through so that you continue in your business. Thank you so much, everyone. I hope you have a wonderful day. Thank you. Bye.